Hi everyone and welcome back to the channel. Today we're talking about something really important. It's sarcopenia. That's the medical name for age-related muscle loss. This is a really serious condition and it's on the rise. And surprisingly, it's on the rise not just in the older population. So what exactly is sarcopenia? Well, it comes from the Greek word sarx, meaning flesh, and penia, meaning loss. So literally it means loss of flesh, or in this case, loss of muscle. It's a condition where your muscle mass and strength gradually decrease. It's most common in older adults, but it doesn't just affect the elderly. It can start as early as your 40s or 50s, and that's especially if you're inactive. And here's the thing, it's not just about losing muscle. Sarcopenia increases your risk of falls, of fractures, of disability, and even early death. And it's now recognized as a medical condition with its own diagnosis, which shows just how serious it can be. So, how common is sarcopenia? Well, studies show that around 5 to 13% of people aged between 60 and 70 are affected. And for those over the age of 80, that rockets up to 50%. And muscle mass actually starts to decline around the age of 50, and strength begins to drop after 65. Sarcopenia affects both men and women, but men tend to lose muscle faster in those earlier years, while women become more affected in very old age. So globally, there's around 50 million people who are dealing with sarcopenia right now. And that's a number that's set to rise to about 200 million in the next few decades. So this is a huge deal. So why does sarcopenia happen? Well, there are a few major reasons. The first one is lack of physical activity, sitting too much. It's just the modern lifestyle, isn't it? Not exercising, this is the number one cause. Next is poor nutrition, especially low protein intake. And you will hear me say time and time again on this channel, protein is the most important macronutrient. It's incredibly important for our long-term health. So the next reason for sarcopenia is a vitamin D deficiency, and that this affects your muscles too. And of course, we know that people as they age, they maybe don't go out as much. Next reason is hormonal changes, things like lower testosterone and lower growth hormone levels. And of course, inflammation and oxidative stress, they come up time and time again, don't they? And they both increase as we age. And yes, of course, aging itself plays a role in the progression of sarcopenia. But the really good news is a lot of these risk factors are changeable. We're not powerless here. We can do something about this for ourselves and our loved ones. So how do you know if you're dealing with sarcopenia? Well, there are a few signs to watch out for. Feeling weaker than usual, although actually, that could be a number of conditions. Struggling to get out of a chair or climb the stairs, a slower walking speed, or having more falls or near falls. So, what tests do the doctors give to see whether or not somebody has the beginning of sarcopenia? Well, they would test things like hand grip strength tests, chair to standing tests, and also questionnaires that ask simple questions about someone's ability to move around and stay steady. And remember, this is not just about looking out for signs in yourself. If you have elderly parents, grandparents, loved ones or people that you care about, keep an eye out for their changes in their mobility too. Are they walking slower? Are they struggling to rise up from the chair? Or are they falling more often? And these could all be signs, early signs of sarcopenia. And so often our elderly loved ones, they won't mention it unless they're asked about it. And so a gentle conversation and some support to get assessed or start light activity can make a huge difference in their quality of life. So here's the good news. Sarcopenia is treatable, and in many cases, you can reverse the muscle loss or at least slow it down. So here's what works. Number one is strength training. Resistance exercise is the gold standard here. Things like body weight exercises, resistance bands, or lifting weights, even simple sit to stand exercises are great. High protein nutrition. Aim for 1 to 1.2 grams of protein per kilogram of body weight every day, and try to get about 20 to 35 grams of protein per meal. That's enough to begin to stimulate muscle growth. So what are examples of good protein sources? So beef, eggs, chicken, tuna, lamb, cheese, they're all great sources of protein. And if you're on a plant-based diet, you'd be looking at things like beans, lentils, tofu, tempeh, or nuts. And don't forget vitamin D, omega-3s, and really staying active during the day. So what about medical interventions? What might a doctor recommend? Testosterone has shown to have some promising results. It can increase muscle mass, strength, and even improve walking speed. However, it does come with some serious risks, including a higher chance of prostate cancer in men and possibly cardiovascular issues as well. But despite these risks, it's still being studied as a potential treatment for sarcopenia. And remember, when I'm talking about these treatments here, these are only ever done under strict medical supervision. So please don't order these off the internet. So the next is something called SARMs, or selective androgen receptor modulators. And SARMs are designed to work like testosterone, but they only target muscle, which may reduce the other side effects that I've just mentioned. Other potential treatments might be human growth hormone, which may increase muscle but has side effects and is quite costly. Vitamin D may boost muscle strength in people with low levels of vitamin D. And exercise, which is still the most important intervention. Resistance training not only helps prevent sarcopenia, but also supports the effects of anabolic therapies. So what are the key takeaways here? Treating sarcopenia may require a personalized approach, combining exercise, nutrition, and possibly anabolic agents. But lifestyle changes are the most effective and the safest approach right now. So to wrap it all up, sarcopenia is not just an old person problem. It is a real medical condition that starts earlier than you might think. But the power is in your hands. Move more, eat well, stay strong. If you found this video helpful, please give it a like and subscribe. And please do share this video with somebody who would benefit from it. A friend who's very inactive, an older relative who needs to understand the importance of enough protein in their diet. So thanks for watching, and I'll see you in the next video.